You know, hip pain can sneak up on anyone from young athletes to active adults. If it's ignored, it can bring bigger problems down the road. And here to share more about what you should know about hip injuries, Dr. Nicholas Vaudreuil with ProLiant Surgeons. Everett Bone and Joint joins me right now. Thanks for being here.
Yeah, thanks,
This is an important topic here. Tell us a little bit about your background first.
Sure, yeah. So I'm a board-certified orthopedic surgeon. I practice in Everett, Washington at ProLiant EBJ. And my subspecialty is sports medicine. And sports medicine surgery can mean a lot of different things. Generally, it's soft tissue injuries, so muscles, tendons, ligaments, cartilage, and special structures inside the joints like labrum tears or meniscus tears. And depending on the provider, it can be either like a really narrow scope of practice or wide. So I wanted to be able to sort of be like a team doctor for my patients and treat as many conditions as possible. So I treat shoulders, elbows, knees, and hips. And the cool thing about sports medicine is the training is designed such that you can do minimally invasive surgical approaches for pretty major injuries.
And you're seeing a lot of people coming in with hip pain.
Yeah, that's a special interest of mine because it's a condition where if we can prevent people from getting arthritis, like bone-on-bone arthritis is such a tough problem. So many people have it, and the options once you get to that point are pretty limited. So I want to kind of preserve hips and prevent arthritis as much as I can. And there's two conditions that really, if you can treat them early on in the course when people are just starting to get symptoms, that you can prevent people from getting arthritis. And those two kind of go hand in hand. One is hip impingement, and one is hip labrum tears. And the way I like to describe it is impingement is basically like two edges of the structure at the joint are impacting or bumping, grinding that shouldn't be. So the top of the hip is actually like a cup, and the lower part, the femur bone, is it's almost like a lollipop. And it's designed to bear weight and twist and do all the cool stuff that we can do. But if there's extra bone either on the top of that lollipop or at the edge of the socket, then you're really damaging the cartilage and the labrum and the bone, and that can lead to early arthritis. So I always want to get these people in early, so if we can figure out a treatment plan that works well for them.
Yeah, when do people know it's time to come see you? I mean, you wake up sore one day. When do you know that it's time to come see you? And then maybe even the next step, when do they know it's time to get surgery?
Totally. So the most classic symptoms people have with this is actually pain like deep in the front of their hip or groin. It's almost like in the underwear line. And sometimes it's pretty mild at rest, but when you're doing activities like running or bending, squatting, lifting weights, you can get pretty sharp stabbing pain or clicking, catching, all those sorts of things. And from my perspective, if it's getting to the point where you're having almost daily or it's affecting your recreations, your sports, then you should get it evaluated because for each patient, it's going to be a different experience. We try to avoid surgery if we can. Like if I can get people back without symptoms or minimal pain, get them back to their activities without surgery, then that's a win for both of us. But if surgery becomes necessary, I want to be able to offer those minimally invasive approaches to people. So the most common thing we do is called hip arthroscopy or hip scope. And basically what that is we do 3 small incisions on sort of the side of the hip and thigh where we can go in with the camera and we actually look at the labrum, the cartilage, all that stuff. So we're able to actually reattach the labrum back to the bone with little anchors and stitches. And we can actually sculpt away that extra bone spurring so that it's not slamming and catching that edge anymore.
Wow. So when do you know that it is time to do that? Because for some people it might be not the last or a drastic resort. Maybe it's going to be the best choice given their situation.
Right, and it's different for everybody. Like I see patients from teenagers all the way up, you know, and some people doing certain activities might feel this when they're a teenager, but some people might just have like low-level pain that they're noticing throughout the day. So it really is just depending on like how much it's limiting people. So surgery is always a discussion. I don't want to rush into it. So it's usually not something I'm recommending at the first time we meet. But again, it's sort of we want to cater the experience to every patient.
This stuff can be scary. It's all about who you know. Why should people consider reaching out to you and ProLiant specifically for their injuries?
Yeah, so ProLiant Everett Bone and Joint, we cover a number of conditions. Both me and my partners, we're happy to see people of all ages. And consider us because we're part of the community. We want to take care of our community, keep our people moving. High school athletes up through weekend warriors. So. And
that's a great point there. Are you seeing mostly people in advanced age, or is it athletic injuries, or is it somewhere in the middle?
It's everything in between.
Wow, okay.
I'd like to think that we just take care of our community, and we want to get people back in the game, whatever their desired level of sport or recreation might be.
Thanks so much for doing this. This is an important thing. We were talking a little bit before the show. I know bone density, hips, all of these things are much more important than maybe the average person thinks about. And we shouldn't probably wait until we can't walk with it, right? When do they know? I'm sure there's some people watching when you said, hey, you're going to feel it in the front of your hip. There's at least some viewers right now saying, well, that's what I feel. What's the next step? How do they reach out?
You're exactly right, Chris. Well, you can reach us on our website. I think we'll be able to pop up the link here, and we have descriptions about different things. But please just reach out to us. We're happy to get people in right away. If you're having that hip or groin pain, please come in and see me.
Thanks for helping us take some of the
Chris.
confusion, some of the fear out of this. This is important stuff. To learn more information about ProLiant Surgeons, Everett Bone and Joint, just visit the website. You see it right there on your screen.
New Day Northwest is sponsored by ProLiant Surgeons, Everett Bone and Joint.